The question is, if you have what we call a perfect storm, if you are in the process of developing diabetes, will an infection really push you into a diagnosis more quickly than you might otherwise have experienced? And it seems like maybe we are now finding out that COVID is one of the viruses that maybe can do that a little more than other viruses. Any viral illness causes it to be more difficult to manage your blood sugars and can put you at risk for the development of diabetic ketoacidosis. And COVID in particular really seems to be putting kids at risk for diabetic ketoacidosis much more frequently when they have type 2 diabetes than we saw with other viral infections in the past. That's a little bit frightening because that's life-threatening. What's happening is they could be tipping the scales toward presentation with diabetes for the first time in someone, I think this is likely, we don't have the data, but that these kids were on their way to developing diabetes anyway. Maybe it would have been in 2 years, maybe it would have been in 5 years, but it was coming, and maybe having this infection pushed them toward an earlier diagnosis. So I would encourage people not to panic. Try to prevent infection, as you have been, I'm sure, most people, and that includes vaccination. And watch for symptoms. Yes, watch for these symptoms and talk to your doctor if you see them.